Okay, so now we will be looking at what will happen if we give too much propofol to the patient. If we give overdose of propofol to the patient, what possible effects or side effects can take place? So first of all, the dose of propofol is 2 to 3 mg per kg. So routinely we give 10 ml of propofol or 10 cc of propofol, maximum 15 cc. But what will happen if we give 20 cc of the propofol to the patient in anesthesia? So there are certain possible side effects that can take place, and a patient can develop a hypotension, or there can be cardiac arrest, or apnea can happen because propofol decreases pressures. It causes hypotension, it causes sedation, and that excessive dose overdose can cause hypotension, and apnea, respiratory arrest, or cardiac arrest can happen to the patient because propofol is an emulsion. It is produced from lecithin of the lipid, and it is lipid soluble. So if we give overdose of this white milk propofol, then patient can have a lot of complications. Like I mentioned, that patient can have hypovolemia, hypotension, apnea, cardiac arrest if the volume or dose exceeds more than 15 ml of the vial ampule. Each ampule contain 20 cc. So if we give whole 20 cc to the patient, then these type of problems can take place in propofol infusion. So we have to take care of that to give dose according to the weight of the patient in order to prevent such side effects. So this is very important during anesthesia because anything can happen if we do overdose it to the patient. So we have to keep the balance, we have to maintain the dosage of the patient, we have to keep our mindset broad spectrum in order to minimize the outcomes of adverse effects. So propofol is very good drug, and we give it in routine sedation, and it is a lipid emulsion, but we have to take care of that in order to prevent the problems of propofol. Like if we give overdosage, it can cause hypotension, apnea, cardiac arrest, and many other problems. So this is the thing that we have to keep in the mind in propofol infusion. So another one is atracurium, that is neuromuscular blocker. We routinely use atracurium, cis atracurium, ketamine, rocuronium, and many other drugs according to the patient.